Hey guys, it's Dr. Chris with Texas Chiro Health. Welcome to our 12 Minutes to Health, where we get to bring the research to you, looking at all the different research that there is out there on health and how to be healthy. And really it comes down to the three things that we're constantly talking about, right? It's eating better, it's getting more exercise, and it's managing your stress. So those are the three things we are constantly talking about in the office with patients, and those are the three things that we put into these 12 minutes of health talks. The research from those, the peer-reviewed, randomized controlled trials, the systematic reviews, the top research out there, so that we can get you the answers about how to be healthy. So I appreciate you guys for joining us, and let's go ahead and dive into the study here. Today, we are looking at a chiropractic study and how effective chiropractic is for low back pain specifically in this study. So this study was done by Schneider et al., and it's called The Comparison of Spinal Manipulation Methods and Usual Medical Care for Acute and Subacute Low Back Pain. So basically, they're looking at low back pain and what a medical doctor would do. And what that comes down to is in this study, they prescribed NSAIDs, your non-steroidal anti-inflammatory drugs, basically just your over-the-counter kind of stuff, the Tylenol, the aspirins. Aspirin or paracetamol is actually what is the gold standard for medicine when a low back pain patient would come in. And they also, the medical doctor, advised the patient to not lay around in bed too long, said that most low back problems are self-limiting, and that if you could stay physically active, it would go away, and take the NSAIDs over the counter. The chiropractic care, they went for 4 weeks, right? So they saw the chiropractor twice a week for 4 weeks, so only 8 visits, okay, over a 4-week period. And they did a chiropractic group. One of the groups had manual adjustments, and one of the groups had what we call activator adjustments, which is just an instrument used to adjust spinal segments, just like what our doctors do with their hands. And we actually use the activator in the office for some things as well. But so they had those 3 groups and they compared them all against each other. There was 107 adults that had low back pain, obviously, that had set in the last 12 weeks. So that's why they said it's acute or it's a subacute low back pain, because it's just recently happened, right? Those 3 groups that I explained to you, they had the manual adjusting. That's a picture of an activator right there. So they had the activator adjusting, and they would adjust the spine, and the medicine or the NSAIDs for the over-the-counter. And the results that came out of this are pretty impressive. So there was a 94% improvement for the patients that were being adjusted. In 4 weeks, in just 8 adjustments, the patients had 94% improvement. When they were adjusted with the activator, it came out to a 69% improvement. And when they took the medicine, it was a 56% improvement. And that's not the percentage improvement. That's got rid of the pain for 94% of the patients, for 69% of the patients, and for 56% of the patients on the other side. So they did measure the improvement on an Oswestry scale. So basically it's just a questionnaire to see, are you functioning better? And the results are very similar to this, just different percentages in there. But to get rid of the pain with the chiropractic adjustment in just 94% in just 8 visits is really incredible. I mean, it almost doubles the outcome from the usual medical care, right? It's not a surprise to me, right? Because I'm in it all day, every day, and so are our doctors. But it's if you have some sort of pain, you've got to see a chiropractor. Like it's proven time and time again through this research. And this was a randomized controlled trial. They randomly split these people up into groups. It was a computer generation. They put all the names into a program and it spit them out into different groups. So it wasn't like, the better ones, the ones that were more active were chiropractic patients versus medical or anything like that. It was a well-done study. And it just goes to show that chiropractic care is effective. So we dig into why, right? I mean, that's the study. Those are the results of the study. But why does it work? And it's pretty simple. And it comes down to Hilton's Law. And if you're a patient of ours, you know what Hilton's Law is, or at least I hope you do. I know you've heard it before and seen the posters. But Hilton's Law basically just says that we've got to stay in motion, okay? Our joints need to move, because the nerve that innervates our joint innervates the skin and the muscles and everything around it, right? So if we put our elbow in a cast and didn't let it move for a period of time, let's just say it's a year, when we take that cast off, the muscles are going to be deteriorated. The bone is going to hurt. The joints are going to hurt to move. You're not going to be able to move them all the way. The skin's going to be a different color. I mean, it's all going to change. But what people don't realize is there's also a spot on our brain for every joint in our body. It's called cortical mapping, right? So when we move our elbow and our brain's under MRI, we actually have a spot on our brain that lights up with that motion, okay? And there's a ton of research on the neurology of it and how, exercise helps the brain and things like that. But part of it is because of this Hilton's Law. So if we're not moving things, then we're slowly losing them, you know what I mean? And it's leading to degeneration and then eventually pain. Well, the same thing's happening in our spine. Every single joint in our spine moves. And there's different joints. You got facet joints back there where the bones move, and those can get stuck. The bones just aren't moving correctly, and that's what the adjustment does, is it puts motion back into your spine. Now, our elbow's pretty easy. We can move that pretty well ourselves, but it's really hard to move the fifth bone down in the middle of your back, right? I can't do it. That's why I see my chiropractor. He helps me out with it. And when things aren't moving correctly because we sit too much, because we have poor posture, because we're not using our bodies like we used to and like they're designed, we don't exercise enough, we have a ton of inflammation, it leads to the degeneration and pain. And degeneration and pain in the spine, you can get arthritis in there and everything else. And that's why chiropractic care works, is because it just restores motion and it keeps things moving the way that they're supposed to. And it outperforms usual medical care in every single study that's done this way. And that's why chiropractic is so much more effective. And I've done talks for you about how it's more cost effective, about how it's safer. I mean, if you think just the safety, I mean, the NSAIDs that they used in this study are like one of the leading causes for stomach ulcers and liver disease and things like that. Our body has to process those chemicals, and they're not great for us to be on long term. And more and more studies come out showing that. And that's why there are no that's what the side effects are to that, right? The side effects to chiropractic are, maybe some soreness for a little bit after the adjustment. And that's if you haven't been adjusted in a while or something like that. But, it's mind-blowing to me when people don't seek their chiropractor first to take care of back pain, neck pain, headaches, and things like that. So just another study that shows, yes, chiropractic is more effective than usual medical care. So if you guys are suffering with something, if the Hilton's Law thing makes a lot of sense to you, the chiropractic thing, and this is another study showing how safe it is, come see us, guys. Stop living with pain. Stop having neck pain, back pain, headaches, any kind of joint pain. I mean, come and see us. It's what we do. We will help put motion back in the joints so that you can get moving correctly again. And we do this, we'll bring you into the office and we'll see exactly what's going on. And we do that for a $39 donation from you to our local monthly charity. So we'll do an exam, consultation, any x-rays that we need so we can see what's going on and show you what we're doing. And we'll do a spinal health assessment too, which is the proprietary software that we use that kind of looks at your whole lifestyle, not just, okay, how do we take care of the pain, but why did the pain start and how do we stop that from ever coming back, right? It gives you your health score, your spinal health score from 1 to 100, so we can best analyze everything that's going on and get you guys feeling better. So it's just a $39 donation, guys. There's no excuse you need to live with pain. There's no reason to live with pain when chiropractic is as effective as it is with dealing with low back pain and neck pain and headaches and all the stuff that we've been talking about. So come in and see us, guys. Take advantage of that opportunity. And remember, on Tuesday nights, we also do these talks over different research topics at 5:15. Every Tuesday at 5:15, the doctor's there for you. We have some refreshments, green smoothies, things like that. So one way or another, come and see us and get your pain taken care of, guys. Thanks. I'll talk to you next time.